Mississippi and the coronavirus.
We know that there are many people across our state who are scared, wondering what this means for themselves, for their family members, and their ability to put food on the table.
A pandemic that started a world away has now arrived here at home, a serious threat to our health, safety, and financial stability. Tonight, our governor and a panel of experts address your questions directly. Live from the WJTV studios, this is a Mississippi Town Hall with Governor Tate Reeves. Good evening. Thank you for joining us. I'm Byron Brown. Tonight, 12 News is hosting a special town hall on the coronavirus pandemic with Governor Tate Reeves. We will be answering the several questions that come directly from you. Let's meet our panel. Of course, we have Governor Tate Reeves from the Mississippi Department of Health, State Epidemiologist Dr. Paul Byers, Jim Craig, who is a Senior Director in the Office of Health Protection, and the Executive Director of MEMA, Greg Michelle. We have been practicing safe social distancing in our newsroom and studio for weeks now. Everyone here is at least 6 feet apart. And to further protect not just ourselves, but our staff who are in the building throughout the day, everyone had their temperatures checked by a nurse practitioner before being let into the studio. A forehead thermometer was used. Everyone tested okay. We'd like to thank our Nexstar Media Group stations in Hattiesburg and Memphis, as well as our partner stations in Mississippi, Louisiana, and Alabama for making this town hall available across the state. We'd also like to thank C Spire for sponsoring tonight's event. There's still some time to get your questions in to Governor Reeves or any member of our panel. Just use the hashtag #AskReeves in our tweet or on Facebook, or send us an email to news@wjtv.com. 12 News' Jade Balexa is standing by at our social news desk, ready to go through those questions as they come in. Jade will be checking back with you a little bit later in the show. Governor, we thank you for being here. But before we get to the questions, State Health Officer Dr. Thomas Dobbs was originally set to join us here as well. Governor, would you shed some light on what happened?
Yeah, so Dr. Dobbs had a prior medical condition that has had him down a little bit this week, and so he hasn't been at full strength, which for those of you who know Dr. Dobbs, you know that what that means is that he's only worked 22 hours a day. For the last 7 days. He has been very involved and engaged through email and through telephone calls and through text. I know to his 2 team members that are here, but also to my team as well. Very engaged in the process. We're looking forward to him getting back fully on board in the game later on this week, if not early next week. And we're praying for him, and we're excited because he has brought tremendous leadership to this effort. We have not made a decision without his input and without his guidance, and he's done a fantastic job, as has his team at the State Department of Health and many other state employees.
Governor, before we get to questions, we'd also like to give you an opportunity to shed some light on the state of the pandemic right now.
Well, where we find ourselves today is with approximately 2,260 cases in Mississippi, approximately 76 deaths. And Ely and I pray every night for every individual that has gotten this virus, and also every individual that has passed away from it. It is exceptionally difficult. No one expected or anticipated that we would find ourselves within 90 days of getting sworn in as Mississippi's 65th governor to have to be dealing with this. But the reality is that I believe that leaders step up in times of crisis, and thanks to the support and help of many, many thousands of Mississippians, and we are making a dent. We are slowing down the spread of this virus. We are actually flattening the curve as we anticipated, and hopefully we are putting our hospitals in a position whereby they don't get strained and have an inability to treat patients that need to be treated. I want to personally thank everyone in Mississippi. The vast majority of you have stepped up. You have done the right thing. You have been willing to social distance. You've been willing to adhere to our shelter-in-place order. You've understood that this is a joint effort, and I want to thank you from the bottom of my heart. And I want to ask you one more time, please work with us over the next several days and weeks. If we will all play our part, we'll get out of this sooner rather than later, and we can get our economy back turning again.
Thank you, Governor. And once, as the governor mentioned, here are those latest numbers from the State Department of Health. As of today, as the governor said, 257 new cases, bringing the state total to 2,260 with 76 deaths. There are also 44 long-term care facilities with outbreaks. Just today, we have learned that 6.6 million Americans filed for unemployment. Last week, Governor, you said today that more than 87,000 claims have been filed right here in Mississippi alone. Walk us through the process of filing for unemployment. Where do people need to go? How do they file? And who qualifies for unemployment?
Well, I just want to make sure everybody in Mississippi understands the severity of this economic crisis that we have. We all know that there's a public health crisis, and in the short run, we're making decisions to deal with that. But in the long run, we're going to deal with an economic crisis, the likes of which this country hasn't seen in a long time. Just for instance, in America, prior to last week, there were in the largest 1 week increase in overall numbers of unemployment insurance claims was 700,000. Last week, we had 6.6 million unemployment insurance claims in America. And this week, which came out earlier today, we had an additional 6.6 million claims. That tells you that for 2 weeks in a row, we're 10 times greater than any 1 week period in the history of America. And so this is very, very challenging. To put it in terms of Mississippi, the week before this pandemic really took off, we had less than 1,000 new unemployment insurance claims. The week after that, we had 5,500. Last week, we had 32,000. And this week, it was reported this morning that we had 45,000 new claims. Again, almost between 85 and 90,000 new claims in Mississippi in the last 3 weeks. It is mind-boggling how many new claims. And many individuals that are trying to file haven't been able to get through. And I know it's been extremely frustrating for Mississippians. It's been frustrating for me. But I want you to know, the way I want you to think about this is if you were at work today and someone came in and asked you, hey, I need you to do 8,000% more work tomorrow than you did today, we would all understand how difficult and how challenging that would be. We've worked really hard to improve our systems. Mississippi has made tremendous progress as it relates to that. And I want everyone to fully appreciate and understand this. You are going to get the benefits that you are entitled to based upon when you lost your job, not based upon when someone answers the phone at the Mississippi Department of Employment Security. We've taken significant measures to improve the access. And through our call center, we've increased the number of employees from approximately 50 to approximately 150 over the last 10 days. And we're going to try to increase that by another 100. But the best thing that you can do if you want to walk through the process, the best way in which to do that is to go to our website, www.mdes.ms.gov. That's MDES as in Mississippi Employment Security Commission, MDES, Mississippi Department of Employment Security.ms.gov. That's the best way to do it. In terms of the people that are going to qualify that may not otherwise have qualified, there's a couple of different changes that we made. Very early on, I made the decision to waive state law, which requires a 1 week waiting period. So now you are no longer having to wait for a week. That's going to take the time that you actually get your first check down from approximately 14 days down to 5 to 10 days. In addition to that, I have waived the requirement in state statute, which says you have to be actively looking for a job, because we understand that when 80-something thousand people lose their jobs that have just disappeared in a matter of days, that requirement is unnecessary. In addition to that, through the Federal CARES Act that President Trump signed, if you are a self-employed individual, you would not have been eligible prior to the CARES Act passing, but now you are eligible if you have lost your job. If you work for a religious entity, and there's a number of categories that historically you would not have been eligible for unemployment, but now you are.
One other question that we're getting about is how money will be paid out for unemployment. Mississippians get their $235 a week for 13 weeks. As part of the federal stimulus package, an additional $600 will be available. Will those unemployed see that $600, and how will they get that money?
Well, it's through the same process. You go in and the best way to do it is through the MDES website. But in addition to that, you can also call our call center, and we'll be sure and put those telephone numbers up on our website as well as on our social media pages. But in addition to that, the other thing that you can do is you can continue to get that $600. Mississippi, by the way, is going to be one of the first states in the nation that additional $600, which is under the pandemic unemployment insurance plan that passed in the CARES Act. Those monies are going to be available for those who are entitled to it as soon as this weekend. And so Mississippi will be one of the first states in the nation to get that done. Now, everyone's not going to get it, but everyone that's entitled to it will ultimately be able to get it. The way in which we do this, because a lot of times people ask, when will I get my check? Nowadays, we no longer do it by check. We do it by debit cards. And so it takes you a few days to get your debit card in the mail. But those are coming if you have, if you are eligible, and if you are one of the 80,000+ that has applied, that has been granted those unemployment benefits.
A lot of questions about unemployment. Lindsay Kellum is wondering about people who work a second part-time job on top of their primary job to make ends meet. Does Mississippi provide partial unemployment benefits, and is there any assistance for reduction of hours or loss of second job or retaining a primary job?
The simple answer is yes, yes, and yes. Unemployment benefits in Mississippi are based upon the amount of money that you earn in a particular week. And so if you are significantly reduce that amount of money that you're earning, or you significantly reduce the number of hours, which leads to significantly less revenue, significantly less income, you can maintain work and still be eligible for certain unemployment benefits.
All right, Jade Alexa, let's go to her. She's now monitoring some other questions from the newsroom. Jade?
Byron, we are getting tons of questions coming into our newsroom. This one is for the governor from Lisa Larry. She wants to know what regulations are in place to ensure that employers are protecting their employees in the event that one of them is tested for COVID-19. Governor?
Well, thank you, Jade. Appreciate that question. I think it's extremely important. Very early on in this process, we issued an executive order which allowed for and maintained what the essential businesses were in Mississippi. It was a comprehensive list. It was based largely on the list that was put out by the Department of Homeland Security of the United States government, and particularly their task force as it relates to essential infrastructure in this country. So we have a list of essential employers, and we maintain that those essential employers must remain open. But we also offered additional guidance through executive orders which said those employers, where possible, must follow CDC guidelines, make sure that we're maintaining social distancing. We have encouraged our employers to do things like what WJTV did here this evening by taking temperatures of employees, by ensuring that those who have any symptoms ultimately get tested, but also if you have any symptoms whereby you are sick, we strongly encourage our employers to allow those individuals to get paid sick leave or to get paid leave at home so that we don't endanger those employees. And I have talked to many small businesses and many employers across the state, and I know the vast majority of them are adhering to those guidelines.
Our next question, Governor, is from William Richards of Vicksburg. Will the state of Mississippi expedite processing of state income tax refunds to help ease the burden on the people?
Well, I know that I've spoken repeatedly with the head of the Department of Revenue, Herb Frierson, himself a former House Appropriations Committee chairman. We're working very closely with him. We have actually delayed the timeline for when you have to file state income taxes. As you may know, the federal government has delayed from April the 15th until July the 15th. The state of Mississippi has delayed the requirement for those to be filed from April the 15th to May the 15th. And therefore, we are having conversations as to whether or not that's the right date, depending on where we are in our cycle and where we are in the curve. But we are trying to process, to the extent possible, any of the refunds that need to be made. We're trying to get those processed as quickly as we possibly can. Have you had to hire more people for the Department of Revenue to deal with that? I don't believe we've hired more people. You know, one of the things that we're seeing is because typically the Department of Revenue actually takes in a large number of claims each month, and a large number, particularly when you get in March and April. Because we were able to delay that from April the 15th back to May the 15th, my understanding is that we've had adequate resources, but we're more than willing to staff it up, just like we've staffed up the Department of Employment Security, should we find that necessary.
Our next question, Governor, is coming from Cynthia Fuller in Yazoo City. She writes, my grandson's hours have been cut to the bare minimum so that the company keeps the worker. If it is not close to what he was making and definitely not enough to pay rent, utilities, and food. is he eligible for any sort of unemployment benefits?
Right, and the answer to that question is yes. That unemployment benefits in Mississippi are dependent upon income, how much income you take in, not if you have a job or not. And so if income falls significantly, then you very well may be eligible for unemployment insurance in Mississippi.
Thank you. We have a question now from our sister station in Memphis with WREG, Greg Hurst. Here's the question.
That have turned into some real hotspots for the coronavirus. What is being done in some of these smaller areas like Tippah County, for instance, which has a higher number of infections and deaths per capita than some of these other areas across the state to help control the spread of the virus?
Well, I didn't hear all of your question. I apologize, but if the question is, are there any places in Mississippi that currently are at risk of having the health system overwhelmed, I will tell you that our State Department of Health is working very closely with hospitals, with physicians, and other healthcare workers. We're making sure that we get out PPE out to our workers. We think that's critically important at this time. And by the way, when you look at the state as a whole, we feel like we have adequate number of beds, we have an adequate number of ICU beds, and we have an adequate number of ventilators at this time. But looking at it as a state as a whole really isn't good enough, because if I have 600 ventilators in Tishomingo County and I have 600 patients in Hancock County, well, having an average of enough ventilators, well, that's just not good enough. I've got to have those in a place where I have the patients. And so logistics are critically important as we move towards our peak in Mississippi. I am not aware of any systems that are currently overwhelmed, but I will tell you that we have set up a hub and spoke model such that if we have systems that are struggling with either equipment or with beds, that we have other areas where we can get those patients so that we can make sure that we accomplish our goal. And our goal is to make sure that every single patient that can get better with quality care gets that quality care.
Our next question is a video submission from Mr. Dale Sanford in Scott County.
Good evening, Governor Reeves. There's a lot of information making the rounds on the internet about home diagnosis and remedies. Could you speak to the detriment that could come from acting on this quote-unquote advice, as well as what you should do if you suspect you have COVID-19? Thank you.
Sure, Dale. Thank you for that question, and I appreciate it. You know, there's one of the things that I have seen, and it's fairly terribly disturbing to me, and that is there's been so much misinformation that has been going around on social media. I want to make sure everybody in Mississippi understands this. We are not going to make news with a meme. If we're going to do something that is critical and important, we're going to do so by having a news conference, by making sure that we put it on social media that comes directly from me. And so to all of those individuals that have decided that they can self-cure, what I would say to you is if you have symptoms, you need to self-isolate immediately. You need to go and communicate with either your primary care physician or someone in the healthcare field, because if you have symptoms, you need to take a test. And if you get a test and it's positive, then you need to self-isolate. You need to either be quarantined. You need to help work with our Department of Health individuals who are working to do case management, because we not only need to self-isolate that individual that may have the virus, we must quarantine or self-isolate those individuals with whom that individual has come in contact with. That's how we slow the spread of the virus. That's the reason our social distancing measures and our proactive plan to attack this is working. And so, but we cannot be successful at doing that unless we have a very good idea of everyone out there that is having symptoms and ultimately has the virus. Without that knowledge, without that information, we're not going to slow the spread as quickly as we need to.
Real quickly, Dr. Byers, what about people who have just pretty much cleaned the shelves of the over-the-counter drugs?
Yeah, and you know, that's such a great question, because it's still our recommendation for those individuals, because we know that this can be a serious infection. We know we've seen deaths. We know that in some individuals, especially those individuals with chronic disease or the elderly who have those underlying medical problems, that this can be very serious and it can progress rapidly. So if you have symptoms, we do want you to communicate with your health care provider or a healthcare worker in your area to make sure that you're following the correct instructions and that you seek medical care if you have a worsening in your symptoms, because that's where the key to treatment and medical intervention can make a difference. So we don't want you just to sit at home if you have a worsening.
All right, thank you. Here's another question. Let's talk about testing. We are roughly, in terms of the number of people who are being tested, how does that compare to the rest of the country and the rest of the world where we stand in Mississippi right now, Governor?
Well, Byron, when we first announced that we were going to attempt to be very proactive in our approach with this virus, obviously we have instituted some defensive measures such as social distancing and shelter in place. Those are defensive measures. Dr. Dobbs and I met and actually announced weeks ago that we're not only going to take those defensive measures, we're going to be very offensive as well. We're going to go on the attack. And in doing so, that includes a strategy that involves significant amounts of testing. And I got to tell you, I've been so impressed by the innovation of research universities here in the state of Mississippi. The University of Southern Mississippi has been very active in establishing their own tests, working with Forest General that has been approved. The University Medical Center for weeks now has done the same thing, utilizing the reagents that exist in their own labs. And because of that proactive approach, Mississippi, the last numbers I saw, and Dr. Byers may have updated numbers in the last 24 hours, we have tested about 22,000 people in Mississippi. When we originally made our announcement, we said that our goal was to test at least as many per 1 million residents as South Korea did. South Korea tested about 5,200 per 1 million residents. They were very aggressive and they were lauded for their testing. We are at 22,000, which is somewhere in the neighborhood of 7,300 per million residents, so we're almost 50% above that model that was used in South Korea that was lauded as a model. If you look at where we are amongst other states, we are, again, pretty consistently within the top 10 to 15 of other states. And keep in mind, that includes states like New York and New Jersey and Louisiana, where the federal government has come in and pumped significant resources into helping them test more. And that's where the hot spots are, and I understand that. It makes sense. I'm not being critical at all. I'm just saying that in Mississippi, we took the advice of President Trump and Vice President Pence very early on, and they said, well, you need to use your existing supply chains. You need to use innovation at your research universities, and we've done that. And because of that, we're a little bit ahead of the curve on testing.
Anything you want to add, Dr. Byers?
Yeah, and with our latest numbers now, we're up close to 25,000 tests in the state. And, we'll be updating those numbers frequently on our website as well.
Another question. Our next question is coming from Tanitra Evans, who is curious about religious exemptions to the social distancing policy. Let's hear what you have to say.
Hello, Governor Reeves. My question is, does the social gathering limit of 10 people or less include churches?
Well, thank you for that question. And obviously that's been a point of contention and a point of debate over the last couple of days. And let me tell you what I believe. I believe that government cannot shut down churches. I believe that there's a constitutional right for our churches to be able to meet. But I also believe that all of us in the state have to chip in together. And I have strongly encouraged pastors across Mississippi to not have church services with more than 10 people there. I think that given where we are in the cycle, if we'll all do that for a couple of weeks, and look, it pains me to say that, with tomorrow being Good Friday and Sunday being Easter, it absolutely pains me to say that. But we need everyone to chip in. And we had a pastor from down in Adams County yesterday that came to our press conference, and he was being threatened by local government, and he wasn't going to back down. Well, my team and I called him and said, look, we understand that you don't want to be shut down by government, and we don't think you can be, but we do think you can make good decisions. He made the decision that he's not going to have. He shut down Bible study on Tuesday night. He's not going to have services with so many people there today, and that's what we're asking our pastors across the state to do. Now, I will also tell you that I have heard reports of local jurisdictions shutting down services for those individuals who actually are in their own vehicles, and they have a radio application where the preacher is preaching to them. No one has gotten out of their vehicle, and I just don't think that's right for the local governments to be doing that either. Our pastors, I beg you, I plead with you to make the right decision. Don't have in-person church services, but I think the local government's trying to take away their constitutional rights is the wrong approach.
So the advice then is to do what? That they can do
My
it in a
advice
parking
is
lot
to
or-
my advice is to not do church services with more than 10 people. Figure out a way to do it online. We can worship online. We can worship by Facebook Live. We can worship by all of the different apps, Zoom, etc. We as Christians in Mississippi know that Easter is not about a building. Easter is about Jesus Christ being risen, and we need to understand that. We need to celebrate it. We're going to do that in Mississippi. We're going to do it in special ways. We're going to do it in different ways than we do most Sundays, but we can do that. We can protect ourselves and still worship on Easter Sunday.
Our next question. This week, the State Department of Health started adding demographics information for COVID-19 cases. As of April 8th, African-American Mississippians accounted for more than half of all cases and 71% of the deaths. That's despite African-Americans making up only about 38% of Mississippi's population, according to estimates from the U.S. Census Bureau last year. Dr. Byers, earlier this week, you said that many had underlying health problems. Do you know if many of them had or were lacking health insurance?
That's a great question. And, you know, there's still a lot of data that we're collecting, and that is a question that we need to look at. And that's data that we need to look at to determine access to care. We know that we've had for a long time chronic underlying medical problems at a higher rate in our African Americans in Mississippi. We know that for a number of reasons, this has been a problem that we've faced for many years, and that's multifactorial. We need to look at, from our data now, to determine, because we don't know a whole lot about this virus yet, we need to know why it's impacting African Americans more. We do know that African Americans have higher rates of chronic underlying medical problems, and if you look at the data that we do have published now, we know that there are, among the deaths, higher rates of hypertension among African American deaths, higher rates of cardiovascular disease among African American deaths, higher rates of diabetes among African American deaths than those in the white deaths. And so we do need to look at this data closely. I think that there's a whole lot of information that we need to continue to gather, and on the back end of this, we're going to be able to get a clearer picture of exactly what's going on.
Governor, given another question coming out is, given all this information, a viewer would like to know, during this emergency, have you changed your mind whether the state government should expand Medicaid?
Well, let me first say, Byron, I want to commend the Department of Health. We have worked with them very, very closely through the beginning of this, and they have been very diligent in being willing to release data. Mississippi was one of the first 10 states in the nation to release demographic data as it relates to this particular virus. And what we are finding is, in Mississippi, just like in other states, that some of whom have expanded Medicaid, some of whom have not, all of this data looks very similar, and that it is attacking those with chronic underlying conditions. This particular virus has not changed my views on the expansion of Medicaid. The one thing that has been made clear to everyone by President Trump, by Vice President Pence, is that everyone is going to get treated for this virus, regardless of their method of payment. The federal government is stepping up and providing $130 billion to hospitals around the state. When you talk about Medicaid expansion, what you're really talking about is an insurance program paid for by the taxpayers that is going to remove some individuals from private health insurance, and it's a method of payment. It is not a method to ensure either access to care or to ensure quality of care.
And so what needs to be done going forward once we get past this?
Well, I think we've got to continue to communicate, to talk with individuals, to make sure that every individual is making good decisions themselves, that they have access to quality foods, things such as that. Many of the underlying conditions that Dr. Byers spoke to, this is a multi-generational challenge. This is not something we're going to get fixed overnight, but we do need to continue to work to improve the quality of health amongst our African Americans in Mississippi. But quite frankly, we need to improve the quality of health amongst all Mississippians. As when you look at things like hypertension and diabetes, we're in the top 3 or 4 in both of those categories in our state. You look at the number of smokers in Mississippi, we're at number 6 in the nation in number of smokers per capita. All of those things have an effect on the underlying chronic conditions. And ultimately, it appears, at least with the early data, And again, there's a lot of analysis yet to be done, but those all appear to be devastating factors with anyone who gets the coronavirus.
We have another video question. This is coming from Ed. He's curious about the follow-up data after someone has tested positive. Here's the question.
Hi, my name is Ed Probilski. I'm from the Brandon Reservoir area, and my question is this, that understandably there's been an emphasis on the number of cases and deaths from COVID-19. But as we've seen from Governor Cuomo of New York, he's able to tell his citizens not only that information, but the number of treated, survived, and released from hospital. Why can't you help with some hopeful information as well?
Well, I will tell you that we have spent a lot of time over the last several days and weeks continuing to gather the data and making sure that we can get as much information as possible out to the citizens of Mississippi. I think that's critically important, and that's information that we'll certainly look towards. You know, one of the things that I will point out about this particular virus is the latest data that I looked at showed that there was slightly over 400,000 COVID-19 cases in America, and roughly half of those are in the state of New York and the state of New Jersey. And so they obviously have had significant outbreaks there, and that's really challenging. I know it's led to real challenges within their healthcare system, but it's something that we definitely want to continue to provide as much information and as much data as possible.
What about releasing those who are recovering, or some numbers out there about recovery? Dr. Byers?
Dr. Byers?
Yes, and that is, you know, I agree. That's going to be a sign of hope for us, for all Mississippians. And we're looking at that data now, and we're going to be releasing that data.
Do you have a time frame when we'll start seeing those numbers?
I hope to have it out by early next week.
Okay.
That'll be great.
Another question. Let's go to Jade Biloxi. She's in the newsroom. Has another question for you. Jade?
Byron, our next question comes from Latoya Smith. Latoya tells us she is an ICU nurse in the COVID-19 unit. She wants to know, is more PPE on the way to our state? She also wants to know, what do you say, Governor, to the nurse who becomes ill and does not have FMLA required to take off work?
Well, to the first question, and I'm going to let Greg Michelle address this as well, because he can tell you the specifics, because that's what he spends most of his time and his team's time working on, bringing more PPE into our state. But the answer is yes. We actually got a supply in today. We have been getting supplies in every single day, and we've been trying to distribute them first to the Tier 1 hospitals, but also to our emergency management personnel in our various regions across the state. We want to make sure that we have adequate PPE in our hospitals, but also adequate PPE for our first responders, et cetera. And to that individual that is working on the front lines, I just want to say thank you. I'm praying for you. I appreciate what you're doing. You are doing the Lord's work. Every single one of you, the doctors, the nurses, the nurse practitioners, every single healthcare worker that is working to fight this virus and fight this disease, I want to thank you for what you're doing. Greg, you want to talk a little bit about the PPE?
Sure, Governor. Great question, and we get that question a lot, particularly with our healthcare workers that are working on the front lines with COVID cases. As the governor has stated, we did get one of two shipments that we were expecting. That one, as we were coming in here today, we were unloading. We got another one coming in later tonight, and then we've got another load that's coming in tomorrow, a fairly large shipment of PPE. PPE has been problematic. It's been problematic worldwide to get it in, but we were one of the first states to get out and establish kind of our own supply line with state resources, and it is coming in, not as large as we'd like it to, but it is coming in, and we're pushing it out just as quickly as we get it.
How are you determining where those PPEs are going?
So the Mississippi Department of Health very early on had already established your priorities by tier, and of course those healthcare facilities, long-term care facilities that are treating COVID patients are getting the first priority efforts of those. Those shipments are actually going straight to those facilities. And then as well, our lower tiered shipments are going out to the county emergency management agencies, and so we push it out accordingly. But those healthcare workers that are working with COVID patients get priority on that field.
And Byron, let me also just point this out, because I think it's important. You know, we have activated over 250 National Guardsmen that are helping on the logistics. They're working in a humanitarian way on this particular crisis, and they're supporting our teams. And I just want to personally thank the men and women in uniform who are working hard every day to distribute that. Logistics is hard. Logistics is challenging when we're getting PPEs into our warehouses here in Jackson. We're trying to get it out as quickly as possible, and they're just working overtime to do so. We've got to keep working. We've got to keep getting better, but we've got a lot of good people working hard on it.
Another viewer question, when it comes to testing, what's the average turnaround time for results? How long are people waiting to find out if they have the virus or not? And what about the status of getting faster tests?
Well, I will tell you that the turnaround for our state testing lab at the Department of Health is approximately 24 hours. There are varying turnaround times as it relates to some of the private labs that are being utilized. And so I'm going to let Dr. Byers speak to that if he will.
Yeah, and that's really dependent upon what lab it's sent to. There are many commercial labs now, and there are hospital labs that are performing the tests, and it's dependent upon that. But it can be anywhere from a quick turnaround of 24 hours, depending on where it needs to be sent to a matter of just a few days.
Yeah, but I do want to point this out, and there's a lot of innovation and ingenuity going into trying to deal with various aspects of this virus. For instance, there is a particular machine that's produced by Abbott, the healthcare provider, that allegedly would provide a test and a result within 15 minutes. Now the problem is they don't have all of the, they can do that, but they haven't been able to mass produce it yet. But the good news is many of these machines are very similar to machines that are in many doctors' offices around the state and around the country. And so there is hope that fairly soon and fairly quickly we're going to get through a quick throughput test where we can get results back very quickly. For us to be extremely successful and extremely confident in continuing to get things worked back, getting our economy back rolling again, we need even more testing than what we're already doing. And a quick turnaround on a test result like that would give everyone a significant amount of confidence that we could do that.
Dr. Byers, several people have been writing and asking about a drug President Trump has been advocating for. Is there a recommended treatment for COVID-19? And what is your opinion on the drug hydroxychloroquine?
Well, right now there's not a specific treatment. It's primarily supportive care. There have been some interesting studies that have shown some improvement utilizing a medication that we know of as Plaquenil or hydroxychloroquine. But there has not been enough research yet to make a firm determination that medication will be utilized. Now, certainly CDC has made some recommendations as well, and we just need a bit more research, I think, right now to determine whether or not that medication is going to be truly effective.
And you have a comment on that?
Well, I would just say, there's been a lot of discussion about that because President Trump has talked about it a lot in various press conferences. But every time I've heard him talk about it, he said, he's got a lot of personal optimism that it's gonna work. But then he also always qualifies that by saying maybe it will, maybe it won't. And so that's certainly an option. And I know they're doing a lot of testing on it now. Obviously. I think everyone in America and certainly everyone in Mississippi is going to feel much better about this particular virus, even if it's coming back in the fall and coming back the fall after that, if we have a vaccine. And there are so many very, very smart people across the country working on getting that done, and I just hope and pray that they get it done as soon as possible.
We have another question. Our next question is about the moratorium on evictions. If someone can't pay rent due to losing his or her job, what kind of assurance can you give them that things will be okay? Well,
in our shelter-in-place order that we enacted as of 5 p.m. last Friday, that goes until April the 20th, evictions are not allowable in Mississippi while people are sheltering in place. Rent's going to ultimately be due, and so what you're going to see is as we not only increase the number of people on unemployment insurance, and we increase the number of dollars that are going to those individuals. What we're hopeful for and what we're making sure is that we get this few week period where evictions cannot occur, And then landlords ought to be able to work with those individuals that are struggling, that are having problems, until they at least get their unemployment benefit checks and things such as that, or debit cards, as it were. We want to make sure that doesn't happen during the shelter in place.
Well, another question kind of related to that. Atlanta and Jackson manages a property and says a tenant who had recently moved in said that he would not be able to pay his rent because he recently lost his job, but says that when she checked on his former place to work, they told her he quit. What can she do if she thinks a tenant is taking advantage of the situation to not pay rent?
Well, I think that's a situation in which, in Mississippi, if you lose your job, you're eligible for unemployment insurance if it's of no fault of your own. And so while the new CARES Act certainly changes that a little bit, that if you can actually quit your job for certain reasons, if it is COVID-19 related, and still be eligible not for all benefits but for some benefits. And so those one of those things that that will have to be worked on a case-by-case basis.
Let's move on to talk about a little bit about schools. For now, schools are closed until the 17th this month, though you've asked districts to make plans for distant learning. Have you heard any feedback about how schools are handling distant learning, and especially for the rural schools that have not a reliable access to internet access? You said yesterday that you might make a decision on school closures on Tuesday. What would you need to do to open schools back up?
Well, we actually had a very good conversation earlier today on a conference call with the chairman of the board of the Department of Education, as well as with our state superintendent. She's been working very closely with her superintendent's council. I've had personal conversations with a number of superintendents and teachers and school leaders around the state, and we're trying to gather all the information, all the data that we possibly can. The thing that I want to do is I want to open schools as soon as possible, if and when it is safe to do so. One of the things that has been a real struggle during this coronavirus pandemic is Mississippi schools were making so much progress. Our Mississippi kids were performing at levels unlike anything we've ever seen before. Our 10-year growth numbers from an education standpoint outperformed every other state in the nation. And that's something I love to brag about, because I get to brag about Mississippi administrators, Mississippi teachers, I get to brag about Mississippi students, and I get to brag about Mississippi parents, because they're doing everything in their power to improve our educational attainment levels, and it's going to be great for us long term. I have been encouraging social distancing, and let me look and tell every single teacher and every single administrator that's been working on that over the last several weeks, I know how hard it's been, but you are making a difference in kids' lives, and I want to personally thank you for the efforts that you have put forth. We are so blessed to have so many teachers in this state that care about their students, that are going above and beyond to help their students. Obviously, there are some districts that have been better prepared for distance learning than others. There are some districts that I've talked to, some are doing distance learning. Some of them are running their school buses so they can take packets of schoolwork out to the kids, and they're just going above and beyond, and I'm just so honored to have the people in Mississippi that, like all of our constituents, are stepping up and doing what's right.
But for those in the rural areas that don't have access to good internet, what are you doing for those, or how can you help those districts?
Well, obviously, there are those that, again, are stepping up and doing things like delivering school supplies, delivering pencils, delivering other supplies to schools, actually on a weekly basis, providing them with schoolwork that they have to perform. And so we've got we're not 100% there, but we've made tremendous progress in ensuring that kids are still learning even though they're not going to the schoolhouse.
Another question, Governor. 12 News viewer asked whether there should be hazard pay for nurses that risk exposure to COVID-19 on their shifts. The city of Jackson just instituted that policy for first responders Tuesday. Is that something you would institute statewide for healthcare workers?
Well, what I would tell you is I can't thank the healthcare workers enough. The reality is that they get up every single day and put themselves at risk of catching this virus, but they get up and put themselves at risk every day as they treat patients, and I'm exceptionally proud of them and proud of what they're doing. We hadn't had any conversation about hazard pay statewide. Many of these individuals work for non-governmental entities and things such as that, and so we'll certainly have that conversation, but that's not one that we've had at this point.
Director Michelle, maybe you might be able to answer this one. This is another question. Roger says somebody needs to donate face masks to pharmacy employees, but also where can you get the general public can get face masks if they can't find them in the stores? Is there a place that people can go?
Yeah, it's hard to find these items right now because of the demand on them. There are, if you've heard the president talk about the air bridge flights that are coming in, half of the supply that's coming on those flights that are coming into the United States are going back to replenish stock in the suppliers that were, that had supplies, normal vendors that you would have bought from. So the intent there is to put supply back into these vendors so that hospitals and other than healthcare workers can have access to these masks. That is just now starting, so we hope to see accessibility for that in the coming weeks.
One thing I would like to add to that, Byron, is the quality of the mask that is needed by healthcare workers and the quality of the mask that is necessary for the general public in terms of just going out to the grocery store, et cetera, are not one and the same. You don't necessarily need N95 mask if you're just going to the grocery store. You want to be able to cover up your face. You want to make sure that you wash your hands regularly, that you use hand sanitizer, but you can use a mask to cover up and socially distance, but you don't have to have an N95 mask if you're a member of the general public simply going to get groceries.
Governor, another question here. You faced some criticism over the time it took to order a statewide shelter in place. One publication in particular, The New Yorker, said you, quote, undermine efforts to contain the virus. Some cities issued their own restrictions before you issued the order. Our question, how did you reach the conclusion that it was time to issue the order, and did you feel any pressure to issue it sooner?
Well, look, when you're in a position such as this and you're facing a pandemic, the likes of which this country hasn't seen in 102 years, everyone is making decisions based upon the best information that they have at this time. I will tell you, and most of the criticism that we received were from people that really weren't getting the same information and the same data and the same expert advice that I was getting from our state health department, from our state health officials, from national health experts, from national health officials. We believe that shelter-in-place orders are something that you can do, but it should be done at a last resort. We believe that it's something that you can do for a certain period of time, but you cannot have shelter-in-place orders in place that go on for weeks and weeks and months on end, because if you do, people are going to quit complying with it. People are going to stop doing what they should do. We believe, and based upon advice from the experts, that the time at which we issued it, we were at the point in the cycle where it made the most sense. We did it for a specific set of time, which was a little over 2 weeks. And what we're seeing now, it appears, is a flattening of the curve, a slowing down. If things continue on the path that we're currently on, we should find ourselves in a situation in which we don't have a significant run on our hospitals where the number of beds or the number of ventilators, et cetera, become a major issue, even though we have put plans in place to deal with the worst case scenario. Byron, we've always said since Hurricane Katrina, our responsibility is to plan for the worst, pray for the best, and expect somewhere in between. And with our team that's here today and many other experts that back them up, we believe we've done that.
When will you determine whether the shelter in place needs to stay or to lift the shelter in place?
We're going to continue looking at the data. We're going to continue to look at the models. There are a lot of models out there. There are a lot of data that we are collecting. There are some models that have significantly decreased their expectations. I'm talking about models that have changed the peak resource date by a week just in the last couple of days. There are models out there that have reduced the number of expected fatalities in Mississippi down by 90% over the last 6 or 7 days. And so again, no one model is perfect, but we're trying to look at all of them. We're trying to look at all of the data, and we're going to make the best decision to recognize that we have a short-term public health crisis from COVID-19, but also with nearly 90,000 people in Mississippi losing their job, we have both a short and a long-term economic crisis, which is ultimately going to lead to public health issues as well. I'm concerned, and we are looking at ways in which to address this. I am concerned about mental health issues. You know, there was a time just 2 weeks ago in the state of Tennessee, they actually had more suicides that week than they had deaths from COVID-19. Now that is no longer the case, but that just kind of tells you some of the challenges that exist out there. You can't just take people and lock them up in their home for months and months on end with no jobs and no way in which to buy food and groceries and other things and think everything's going to be okay. We got to look at all factors.
Let's go back to the newsroom with Jade Balexa, who has another question. Jade?
Byron, we're going to go back to unemployment now. Tracy Ross has a question for Governor Reeves. She wants to know, can you explain further on who will be or will not be eligible for the extra $600 for the unemployment benefit? If you have already filed for your unemployment insurance, do you have to fill out any extra forms to get the extra $600 for the unemployment benefit?
Yes, you do have to file for the pandemic unemployment insurance. We actually had a press conference earlier today at 2:30 in which I had both the director of the Department of Employment Security and her chief deputy as it relates to unemployment, and we spent literally an hour and a half talking about all of the details. We don't have an hour and a half here tonight to address that, but I would push you or encourage you to go to MDES's website at www.mdes.ms.gov. You can go to our social media pages at Tate Reeves, whether it's on Facebook or Twitter, etc. And I'm sure WJTV will do something similar, and the other stations around the state will help pump out that information. But you will have to qualify and apply for the pandemic unemployment insurance. But what I want everyone to understand is if you are eligible for it and you are entitled to it, you will get it based upon the day that you lost your job and or the day that the disaster began according to the CARES Act, not based upon when you actually get through and get it filed.
Another question. There have been at least 11 Mississippi Department of Corrections employees tested for COVID-19 with 3 positive results. 3 inmates have been tested, 2 negative results, and last we heard, 1 is still pending. What is being done in the prison system to protect inmates and to protect the staff?
Yeah, so I had a call with our Department of Corrections team, which obviously has had a lot of turnover over the last several weeks, and we've got a team over there that's working very, very hard. The latest information that I have is that there was 3 inmates that have been tested that were in facilities. 2 of those tests came back negative. 1 of those tests is still pending. I have not received an update this afternoon as to whether or not that test has come in yet or not. But we've done a number of things at our correctional facilities to work to try to limit the risk of there being a break out there. We have done things such as limiting and, quite frankly, eliminating all visitors to those facilities, which, by the way, is a terrible hardship for those inmates. It's also a terrible hardship for the families, but it was the right thing to do at the right time. In addition to that, much like we saw here at WJTV, where we are actually taking temperatures of all of our workers that are coming into the facilities so that if they were to have a fever, that they would not be allowed to come into the facility. We're also taking the necessary measures to make sure that if an individual feels bad, if they have symptoms, that they are not allowed on the facilities. And we're working very, very hard to protect all Mississippians, but to protect inmates as well.
Pam Peaks asks a question here, if you are considering early release of nonviolent or first-time offenders.
Well, we've certainly, Pam, had a number of recommendations. We're working with our Department of Corrections staff, everything from nonviolent offenders all the way to those who are currently will be eligible for parole within the next 30 to 60 days. And so we're monitoring and looking at every one of those potential cases. We haven't made the decision to do that yet, but we are certainly looking at it.
Governor Reeves, as part of your shelter-in-place order, you outlined a number of businesses that are considered essential. Irma would like to know why liquor stores qualify as part of that list.
Well, we actually utilize guidance from the United States Department of Homeland Security that listed a large number of essential businesses. One of the things that we have to ensure occurs, we have to make sure that the supply chain in America continues. We have to make sure that our truck drivers, for instance, are on the road and are delivering goods and services to grocery stores, to our healthcare workers. And so that list actually is fairly inclusive. We also listed churches on that list because we believe churches have a constitutional right to not be shut down by their government, but we also believe that churches ought to act responsibly, as we should all the other essential businesses, and comply with CDC guidelines of not having groups of 10 or more in confined spaces.
One little quick question here with go to Director Michelle. Mississippi is coming off a number of natural disasters. Has COVID-19 impacted the recovery from the historic flooding or storms?
To some degree it has, because COVID-19 has been very demanding, but recovery efforts, working through those disasters continues. We brought in some additional folks in our disaster reservist program to assist us with that. We've got another federal declaration pending right now for some other storms that we had earlier this year. So yeah, absolutely, at some point in time, it does put a drain on your manpower, but we continue to monitor those disasters and are processing everything on schedule.
Thank you. And before we go, here are just some of the things that you can do to keep yourself as safe as possible. According to the State Department of Health, stay home as much as you can, leaving only for essential trips like to the grocery store or to get prescriptions. And when you are out, wear something like a handmade cloth mask. Avoid touching your eyes, nose, and mouth, and wash your hands frequently, especially after a coughing or sneezing, and make sure to use soap and water for at least 20 seconds. Now, Governor Reeves, let's give you a quick second to say a quick goodbye.
Well, thank you to everyone in Mississippi for what you are doing. The vast majority of you are stepping up, and you're taking care of yourselves and you're taking care of your neighbors. For those of you that are over the age of 65, or if you have underlying chronic medical conditions particularly, please stay home. These next several weeks are critical in slowing the spread of the virus. If you're a young person and you think you're healthy, please stay home, because it's very possible that you may be a carrier even if you're asymptomatic, and then you may give that to your mom or your grandmom, your dad or your granddad, and nobody wants that on their conscience. So please, no matter who you are, only travel for essential reasons, only go to work for essential businesses. Working together, we can make a difference.
Thank you, Governor Reeves, and thank you again, Governor Reeves and Dr. Paul Byers, Jim Craig, and Greg Michelle, to C Spire for sponsoring tonight's statewide town hall. And thank you for watching, for your questions. We're going to continue our conversation on WJTV.com. Dr. Timothy Quinn, who is on the City of Jackson's COVID-19 Task Force, will be here. For all of us here at 12 News, we wish you the best for you and your family. Stay safe. Until next time, make it a good night.